All right, welcome back to Bayou Time. Again, we're visiting with Dr. Craig Walker, world-renowned cardiologist and founder, president, medical director at Cardiovascular Institute of the South. We were talking about new procedure performed. Again, he was the first in the world to perform it to help, use this technology to treat peripheral artery disease. And, Doc, when we're talking about PAD, talk about the seriousness of it and why we should all be aware of it, and we should make sure we're getting checked for it and the risk factors associated.
Sure. Historically, people thought peripheral arterial disease was just a problem of leg pain. And really, it wasn't given an awful lot of attention because of that. But we know it's much more than that. It is often the only sign that someone has advanced atherosclerotic disease. There was a trial done in the past called a Partners trial. And in the Partners trial, they measured blood pressures in the arms and legs of all people who were either over the age of 50 if they had smoked or had diabetes, or over the age of 70 just by the fact that they were over age 70. And what they found in that study, 29% of people in those groups actually had evidence of blockage in the arteries to their legs. Now, the overwhelming majority of those patients either did not have symptoms at all, or they had symptoms they thought was something else. They thought they might have arthritis, or they thought they might have other problems. Now, why is this important? Well, it's important because if you have blocked leg arteries, you're very likely to have blocked heart arteries. You're very likely to have blocked arteries going to the carotids. And so we can put our fingers on foot pulses, and if they're absent, we know that that's someone who's at much greater risk of going on to have not just loss of their leg, but to have a heart attack or a stroke and the loss of life. So to start with, it is a great opportunity to pick up very important disease that might otherwise be missed. Secondly, this represents something that limits people tremendously. You know, we take for granted the ability to walk and do things, but when you lose that ability, you realize what a problem it is. Now, what happens in many people is they realize that if they walk slower, they can get by without their muscles aching as they walk. So instead of saying, hey, I've got a big problem, they just simply walk so slow, they walk a block behind everyone else so that they don't push their muscles to the point that they're not getting enough blood. So this is really something that has profound morbidity. It has a real risk in terms of death. It affects anything we do futuristically. If this person comes in and needs, for instance, bypass surgery, and we have to take veins out of the leg, but there's very poor blood flow to the leg, that leg may not heal. It matters for so many different things in terms of how these patients respond to other treatments. Can they undergo chemotherapy? Can they have other things for other disease processes? So it is a very, very important thing for us to look for. And certainly there's some people who are much more at risk. Clearly smokers and people with diabetes. But people with high blood pressure, people with high cholesterol, people with family history of leg blockages or aneurysms. Very important that these people ask that that be evaluated, that they take their shoes off and let people check their pulses.
So, you know, if you go in, if you're this person who goes in, you know, once a year to just your family physician to get a checkup, is this something that's normally checked, you know, by a family physician, or should you be checked, I guess, by someone with a more specialized feel for something like this?
Certainly a family physician can do this.
Okay.
And it's just a matter of family physicians under a lot of pressure today. They have to see a lot of folks, a lot of sick people. But certainly one can just ask, would you mind checking the pulses in my feet and have your shoes off? Within just a few seconds, they can tell you if their pulse is there or not. If they're not, it should be investigated.
Okay. And is there ever a problem, I guess, can you check it yourself?
Sure. It is, you have to understand where the pulse is, and so you may not feel it all the time, but if there's a little bone that pokes out right at our ankle on the inside part of our ankle, that is called the medial malleolus. If you feel right behind that, that's where the posterior tibial artery pulse should be. The dorsal pedal pulse would be on the top of the foot, and if you feel on the top of the foot, you would feel that. If you feel either of those, you're probably just fine. If you don't feel it, one of two things is happening. Either A, you may not have a pulse, or B, you may be feeling in the wrong spot and simply missing it. But if you feel one, then you know you're okay.
Okay. You mentioned, blood pressure issues in the legs. If you go to the doctor, whatever, you always get checked, and they usually put the blood pressure cuff on your arm somewhere. Is it something that you have your patients, check their blood pressures on their legs if they've been diagnosed or if they're at risk for? So if they're sitting at home and checking their blood pressure, should you not only check, the arm pressure, but other areas as well?
Yeah, I suggest to any diabetic or anyone over age 70 or anyone who has smoked over age 50 to have pressures measured in the arms and the legs. It's real simple. It's the same arteries. We're just checking with a cuff, squeezing and measuring the pressure. Blood pressure should be the same. Systolic pressure should be the same throughout our body. If in the legs it's lower than it is in the arms, substantially lower, then that means there's a blockage somewhere. Otherwise, it would be the same. And that doesn't necessarily mean that you have to have an intervention to open up an artery, but it does mean you're at higher risk. And that person that should then start being careful. That person should pay attention to their health and make sure that they take precautions to lessen risk of death from atherosclerotic disease.
So again, the PA, if you have potentially PAD, your blood pressure in your legs will be lower. So if you're a person with high blood pressure and you're checking your blood pressure to see, hey, is my blood pressure a little high today, and you happen to check your legs, you would expect it to be lower if they had that issue.
In fact, one of the things I'm often asked, patients will come in often and say, Doc, my pressures in my two arms are different. And I said, well, that shouldn't be the case. If you have a difference in pressure that is substantial, more than 10 millimeters of mercury pressure difference, that means the arm with the lower pressure actually has a blockage somewhere going to that arm, most commonly at the origin of the subclavian, still in the chest. But that certainly can occur as well. It's very important to understand these concepts because, for instance, if you have atherosclerosis, it then becomes incredibly important to lower your cholesterol, to control your blood pressure, to make sure you don't smoke, perhaps to take at least an aspirin a day to stop any clot from forming there. So these aren't minor points. These are things that can be life-saving. Still, for all the problems we face with cancer, atherosclerotic cardiovascular disease is still overwhelmingly the #1 cause of death and disability in this country. So we have to do a better job.
Yeah, and it's funny you mentioned that because, you see all of the promotions on TV. You even see Major League Baseball, the NFL, they do all these promotions to promote awareness for cancer. And we should be aware of that because we all know someone who's been affected by that. But you're right, we don't see, I guess, enough national media coverage or awareness campaigns regarding cardiovascular disease prevention and things of that sort. What is just, things that the average person can do to just make sure they're in good cardiovascular health? Everybody knows, exercise, obviously, but if you could just elaborate on that.
Sure. Exercise is very important. Clearly don't smoke. Very important. Try to keep body weight ideal because as body weight goes up, our risk for diabetes goes up. In men, a baby aspirin a day is probably not a bad idea if there's no reason to suspect a big bleeding. In women, that did not seem to help quite as much. Now, in women, a baby aspirin can be very helpful if they have known atherosclerotic disease, but just for population in general, it did not show the same level of benefit. And then simply just being vigilant. If you have chest pains, don't assume it's heartburn. If you have severe leg pains, don't always assume that it's arthritis, because if it's involving the muscle, more often than not, it's going to be vascular and not arthritic. And then remember, we haven't even touched on the other side of the circulation, the veins.
Yeah.
And they're a problem too. If legs swell, we have to consider that as well.
Okay, very good. Now you mentioned, maybe a good idea for certain men to take baby aspirin. what age, I guess, is that appropriate for?
Yeah, it really depends upon overall risk and how many risk factors one has.
Okay.
But let's say in a diabetic, certainly by age 50, we ought to be strongly considering that. And if there are other risk factors like smoking, perhaps even younger than that.
Okay, very good. Let's take another break. If you have some time, can we continue to talk? Okay.
Sure.
Well, Dr. Walker, stick around for another segment, so we'll continue to visit with him. Stay with us. We have more right here on Bayou Time.